talk a little buffering with you guys.
Nice. Everybody's buffering these days, is what they do. Well, a lot of people out there are probably saying, what is this, and why should I have it in my practice? So, who wants to kind of get the ball rolling a little bit and tell us what exactly this is? A lot of people probably heard of buffering, but may not be really familiar with the whole process. So,
Jason, I will start with that because I think a
nice.
lot of a lot of dentists um, tend to be what if people. Like we think of all the reasons why something won't work, and I also think we're plagued with it just fine. And what I mean by that is I I actually am kind of proud of how comfortable I can give injections. So why would I change anything? I can get blocks, but there's always those patients that ruin your day and they can never get numb. We blame them for having redhead in their family somewhere along the line, or they had a hot tooth.
Gingers.
um, so I feel like I had all of the same things. Like, why would I change anything when what we're doing is working just fine? And it's kind of like, well, why sending my crowns to a lab works just fine. But as we evolve and improve, I knew I wanted to bring this in. One, my friends were talking about it, but two, we had Stanley Malmed here for a full day lecture last March. I wasn't able to attend, but I got the notes. And yes, I'm that kind of nerd. And I went through it. And he just showed too much proof to not use buffering. And I just wanted something easy. I'm all about like simplifying, and anything I can delegate is always great as well. And when Rich Rosenblatt talked to me about Anutra, I'm like, sure, I'll give it a try. And that's when I got to meet Brad. But it was like almost immediate. I could notice a difference in many things, which we can talk about. But even when I give good, injections and patients are like, wow, I hardly felt that. You always think about this hardly, right? Hardly felt that. And there was always like a nose scrunch, which if Ollie's watching, that's what I'm famous for. Um, but
Brad Keener.
yeah, but it really took away that stinging. And the patients, when I asked them, they said that afterwards they didn't have discomfort. And most importantly, we get pulpal anesthesia fast. And I have some nerdy stuff I would love to talk about, but I just wanted to give a quick intro as to why I finally changed and that I had all the same, I think excuses are a good term, as to why I didn't need it. And now that I have it, I can certainly see a difference. And it's like the easiest thing in the world to implement. It's not like implementing sleep.
Right. Yeah, I think you brought up a good point, Dr. Elliot. We all get stuck in our ways. We're used to doing the same thing that we've been taught. Don't necessarily always like change. But one thing buffering is proven to do is to give tremendous patient comfort, like you talked about, but also the onset. And I think, in today's world of running a great business, but also kind of in these COVID times with, you know, getting the patient in and out, having a syringe that can be sterilized, there's all these different factors that are playing in. I think buffering has become more of an acceptable, okay, I'm going to look at this, I'm going to try it. Oh, wow, it's really working. Whereas it's been all my life. That's kind of what we're seeing right now with our customers.
Why does it work so well? What's the mechanism in there that makes it all happen?
Yeah, so good question. So it's simple. It's sodium bicarb. And the traditional anesthetic that you guys, have always used, um, it has a preservative in there that keeps it stable. And when you inject, your body has to break that down. So it takes a little bit longer. But when you add sodium bicarb to lidocaine, it has a neutral pH and then speeds up that onset. So it's already buffered by the time you do that injection, so your body absorbs it rapidly. So something as simple as baking soda changes the world.